let me ask you something. Why is it easier to commit healthcare fraud than it is to get your mom to a doctor's appointment? One of the largest insurance companies in the US is being investigated for faking diagnosis to bill more money from Medicare. Meanwhile, a daughter is missing work again because her dad's transportation never showed up. This is just not like life in the system, that's betrayal. And the people who pay the price, they are the ones doing everything right. Let's talk about caregiving. Not the cute word on the brochures, the real thing. It's parents raising disabled children without enough help, without enough money, without sleep. It's adult kids taking care of their aging parents, while filling down jobs, managing households, and slowly burning out. You don't call yourself a caregiver, you just say, I'm just being a good daughter, or I'm just doing what it needs to be done. But let's call it what it is. You are doing the work of the healthcare system for free. Now, here's where it gets worse. The U.S. Department of Justice is investigating United Health for something called upcoding. That's when insurers make patients look sicker on paper just to collect more money from Medicare. Let that sink in. While you are managing med and hospital bills, they're allegedly manipulating codes to pocket billions of dollars. And this isn't right. Healthcare fraud costs us over $100 billion every year. But this is not just a number. It's for higher premiums, it's long wait times, it's denied claims, it's families being crushed by a system that promises honesty and rewards abuse. And even if you're not dealing with fraud, you are probably drowning in complexity. Apps that don't sync, portals that crash, 5 different logins just to see lab results. It's not innovation, it's chaos. We are asking families to manage their own care, their parents' care, their kids' care, with a bunch of sticky notes and a Wi-Fi signal. It's no wonder people are crying in their cars, they're exhausted. Not because weak, but because they've been abandoned by a system that was supposed to help. So what do? We stop treating caregivers like invisible workers, and we stop acting like fraud is just bad apples. Here's what has to happen. First, fraud shouldn't be easier than getting care. We get smart technology. Use it to stop fraud before it gets out of control. If you're paying by the rate, you shouldn't be the one getting punished. With the end, stop paying for fake codes, waiting for the real care. The system is smart when patients look sicker on paper, but families still can get what they need. That makes no sense. Third, we need to know the price. No more hidden fees or surprise bills. People should know what they will pay before they step into a doctor's office. That's basics and that's completely fair. Fourth, protected people who speak up. Most fraud isn't caused by audits, it's caused by the people, the brave people on the inside. But they won't say a word if it means losing their job. We have to protect them. And fifth, we need tools that actually help. Not another app that wastes your time. Not another policy that leads nowhere. We need tools that make life easier when life is already hard. That's why we built SNAH. It's just not another startup. It's not one of these health apps that look good in theory, but no one actually uses. And this is a real solution, built for real people living real lives. With SNAH, you can book and track medical rights with ease. You can manage your prescriptions with reminders so nothing gets missed. Coordinate care with your family, all in one place. Book telemedicine visits, in-person appointments, or even 24/7 household doctors. Get help when you are burned out, because sometimes we just can't do it all alone. And most of all, you get support that's fast, simple, and actually human. No more dropping between apps, no more phone tags, no more wondering if anyone is coming. Just care, delivered clearly, safely, and on your terms, all in one place. We didn't build it to replace caregivers. We built it to finally support them. So if you're a parent raising a child with special needs, if you're caring for a sick spouse or an aging parent, if you are navigating this system and thinking, I can't keep doing this, let me say this clearly. You're not crazy. You are not weak. You are not alone. You are doing the real work. And you deserve real support. That's what SNAH is here for. Not to fix everything, but to stand with the people who hold the whole system together. Thank you.